Electrolytes help with many things, like transmitting nerve impulses and maintaining proper muscle actions. So, it's important that levels of electrolytes don't get too high or too low. Because electrolytes are dissolved in body fluids, your body's fluid balance and electrolyte balance are closely intertwined. In this lesson, you'll learn about mechanisms that influence the fluid and electrolyte balance in your body. Like the ocean, you hold a lot of water. In fact, well over half of your body weight is due to the fluids inside of you. In order to maintain fluid and electrolyte balance, the amount of water coming into your body must equal the water you lose through things like sweating, breathing, and going to the bathroom. This balancing act is orchestrated by a few mechanisms, including thirst, or the desire to drink. If your water level starts to drop, your thirst is stimulated. If your body has too much water, thirst is turned off. Another mechanism that helps with the regulation of body fluid is the communication that takes place between your pituitary gland and your kidneys, which are the paired organs that excrete urine. Your pituitary gland is an endocrine gland found at the base of your brain that secretes antidiuretic hormone. If the fluid level inside of you gets too low, it jumps into action. Antidiuretic hormone, which is also known as ADH or vasopressin, carries an order to your kidneys telling them to stop excreting urine. The action of this hormone is easy to recall if you remember that the prefix anti means opposed and the suffix diuretic refers to urination. So, antidiuretic hormone is secreted to oppose urination. Earlier, I mentioned that fluid and electrolyte balance in the body are closely intertwined. This is very true. In fact, electrolytes help your body maintain normal fluid levels. Body water moves from one area to another, based on the concentration of electrolytes. If an area of your body has a lot of electrolytes, particularly sodium, water goes there to bring the electrolyte concentration down. To recall this, I always think that water likes salt, so, water follows salt wherever it goes. Electrolyte balance. Sodium is not the only electrolyte found in your body. Some of the other important electrolytes include potassium, chloride, calcium, and magnesium. Your kidneys are important regulators of electrolytes. If your body has too many of any type of electrolyte, it can filter more of them out of the blood and excrete them. If your body is low on a certain electrolyte, your kidneys can return them to your blood. Because of the role your kidneys play in retaining or eliminating electrolytes in water, it's easy to see that a kidney disorder could throw off your body's balance. There are also medications, such as diuretics, that could interfere with your body's fluid and electrolyte balance. We already learned that the term diuretic refers to urination. Diuretics, therefore, are a type of medication that encourages urination. These drugs make you urinate more often, by forcing your kidneys to excrete higher than normal amounts of sodium. Because water loves salt, water follows the extra sodium out through your urine. Electrolyte balance can also be thrown off if factors lead you to become dehydrated. In other words, if something happens that causes the loss of a large amount of water from your body. Many people think of dehydration in association with excessive sweating on a hot summer's day. This is one of the possible factors, but there are others. For instance, if you've ever been really sick, then you're already familiar with some of the more common factors that can lead to dehydration, such as continual vomiting or diarrhea. If you scoop up a cup of water from the ocean, it will look much like the fresh water that comes out of your kitchen faucet. Yet we all know that ocean water contains salt. The salt in ocean water is needed for the different sea creatures to survive. The water in your body, like ocean water, contains salt and other dissolved minerals. The electrically charged minerals found in your body fluids are called electrolytes. When they're out of balance, your health and survival are threatened. In this lesson, you'll learn about fluid and electrolyte imbalance within the body. What are electrolyte disorders? There are many electrolytes in your body. Some of the most important are sodium, potassium, calcium, chloride, magnesium, and phosphate. Your body must maintain the most appropriate concentrations of these electrolytes in order for your muscles, brain, nerves and other body processes to function properly. If the concentration of one electrolyte gets too high or too low, we say that it's hyper or hypo. For instance, if calcium levels get too high, it creates a condition called hypercalcemia. If calcium levels get too low, it results in hypocalcemia. Variations in electrolyte levels sometimes go by their Latin names, which can be a bit more to remember. For example, the Latin word cal signifies potassium. So, hyperkalemia is the term used to describe abnormally high concentrations of potassium, and hypokalemia means abnormally low concentrations of potassium. What are causes for electrolyte imbalance? There are different reasons why electrolyte concentrations can become imbalanced. Because electrolytes are dissolved in body fluids, we see that dehydration is a possible cause. When there's less body water, the concentration of an electrolyte increases. For instance, hypernatremia, which is having too much sodium, can result if you don't drink enough water. Or you lose excessive amounts of water through vomiting, diarrhea, or severe burns. When you sweat excessively, you lose both water and salt. If you only replenish the lost fluid without actively replenishing the lost electrolytes, you could dilute sodium in the body, leading to hyponatremia. Or too little sodium. Many commercial sports drinks promise to replace water and electrolytes. Certain medications can upset your fluid and electrolyte balance. For example, diuretics are drugs that increase the frequency of urination. Diuretics help a person with high blood pressure get rid of retained fluids, but also influence the fluid and electrolyte balance of the body. We also see that kidney problems can cause imbalances. Your kidneys are the organs that filter blood fluids and electrolytes. So, any condition involving the kidneys can throw off the balance of fluid and electrolytes in the body. Other conditions that could result in an imbalance include certain cancers, thyroid disorders, diabetes, eating disorders, alcoholism, and congestive heart failure. Fluid and electrolyte imbalances can manifest in a number of different ways. Mild imbalances may produce no symptoms, and only be revealed thanks to a routine blood test. If the imbalance progresses, a person's muscle and nerve function could malfunction. This could lead to symptoms such as fatigue, weakness, pain, or an irregular heartbeat. Because fluid and electrolyte balance is important to brain function. A person with an imbalance might experience a change in mood or confusion. Other symptoms could develop due to an imbalance, including nausea, bowel irregularity, abdominal cramps, or seizures. Treating a person with an electrolyte disorder varies depending on which electrolyte is out of balance. However, care is always directed toward the same outcome, which is to restore balance. Intravenous IV fluids are a quick and efficient way to replace fluids lost from things like vomiting and diarrhea. An IV can also be used to restore electrolytes that might be too low. Oral medications may be used to replenish lost electrolytes, or to help the body get rid of excess fluid or electrolytes. Supplements may be recommended to replenish low electrolyte levels over time. If a condition, such as a kidney disorder, causes the imbalance, the patient's medical team will work to correct the underlying problem to prevent a relapse. This portion of the lesson discusses the details about hydrating agents that can be given intravenously and the administration of electrolytes. We'll take a look at the importance of water and electrolyte balance as well. It has been well documented that our bodies are made mostly of water. In fact, we are made up of between 70% to 80% water. This is not by coincidence. We are composed of that much water because water is needed for every process that takes place in our bodies. Water isn't the only key player in most processes in our bodies. Equally important are the electrolytes in our bodies. You have heard that word before. Electrolytes are the chemical ions necessary for body processes. The main electrolytes needed in the body are sodium, abbreviated as Na, and potassium, abbreviated as K. Other pertinent electrolytes include magnesium, phosphate, and chloride. Both water and electrolytes are so important to the body that they must be maintained at certain levels. And they must be in balance with each other in order to carry out bodily functions. This balance between the amount of water and electrolytes in the body is called the water-electrolyte balance. The balance is usually maintained by the kidneys. There are times that there is not enough water to allow the kidneys to do their job. When a person has lower than normal water levels in the body, we call this dehydration. Dehydration can cause many problems in the body, largely due to the fact that the body starts to shut down without enough water. Having lower than normal water levels also throws off the body's water-electrolyte balance. That can be very dangerous and deadly if not corrected quickly and correctly. That is where you and other healthcare professionals come to the rescue. Now there are times when a person can just simply drink water or consume other fluids to correct mild cases of dehydration. This is even sometimes done in the hospital if the case is very mild, and other problems have not started as a result of dehydration. When it is a more serious case, or problems are happening in the body as a result of dehydration, then nurses or other healthcare professionals administer hydrating agents that contain water and electrolytes to restore the normal water-electrolyte balance through an intravenous line. One hydrating agent is lactated ringers, abbreviated as LR, which is a solution of sodium chloride, potassium chloride, sodium lactate, and calcium chloride. Lactated ringers are the preferred hydrating agent when a patient is dehydrated and has a mild case of acidosis. Because of the amount of potassium in the solution, it will rarely, if ever, be used for patients that have high blood potassium or conditions that could lead to high blood potassium. It is also not given to patients that are experiencing alkalosis. Sometimes patients are dehydrated due to not eating or drinking. This not only throws off the water-electrolyte balance, but it also causes a drop in blood sugar levels. These patients will most likely receive 5% dextrose and water, also called D5W, which is a solution of 5% dextrose in water. Dextrose is a sugar that can be broken down into glucose, the sugar that is needed in the body. This will help with hydrating the patient and raising the blood sugar level. 5% dextrose is not normally given to patients that have diabetes, kidney disease, or liver disease. Normal saline is the hydrating agent used most often. It is a solution of water and 9.5 grams per liter of sodium chloride. Patients that aren't able to receive the previous two agents are normally able to receive normal saline. There are some patients that need to be monitored more closely if they receive normal saline. These include patients with edema, congestive heart failure, and reduced kidney function. Normal saline can help to fully restore the water-electrolyte balance. The reason why normal saline cannot be used for the conditions I just mentioned is mostly because of the amount of sodium contained in the solution. There is a better option for those patients, called half-normal saline. This solution of 4.5 grams per liter of sodium chloride has less electrolytes in it than normal saline. It can help with patients that are dehydrated but still have close to normal electrolyte levels. The last hydrating agent that is commonly used is dextrose in saline, also called D5 half-normal saline. You probably realize based on the name that it contains both sodium and dextrose. Dextrose in saline is a solution of 2.5% dextrose and 4.5 grams per liter of sodium chloride. This is a better option for patients that have some of the conditions that prevent administration of the other hydrating agents. Electrolyte supplements. Similar to how there are some patients that may need just water, there are some patients that may need just electrolytes. Electrolytes are usually best replaced by simply eating foods or consuming drinks that contain electrolytes. Common table salt can usually correct a drop in electrolytes. In the event that medical intervention is needed, there are a couple of options available. Oral electrolytes are electrolytes given in pill or powder form. The powder gets dissolved in water, and then, the patient drinks the solution. The oral electrolytes don't cause very quick and drastic changes to the electrolyte levels. Oral electrolytes are used in patients that can't or won't eat and in those suffering from severe diarrhea and/or vomiting. If the patient is eating, then their diet will be monitored to ensure they don't consume too much salt or other electrolytes. We don't want the opposite problem to occur. The other option is to give IV electrolytes, or electrolytes administered through an IV line. This is most often used if a patient is overhydrated, can't eat, is a burn victim, or has some severe intestinal diseases. The composition of electrolytes will vary based upon the needs of the individual patient.